So you've probably landed on this video because you've put a search into Google or YouTube for how to do a perineal massage. It's quite difficult to try and demonstrate how to do it when you're not doing it on yourself. So what I've done for the sake of this video is I'm going to be using a cardboard cutout. So please don't laugh, but as you can see here, we have got the vulva and we have got the vagina and we've got some legs, okay? So why would you want to do a perineal massage? Well, certain studies have actually shown that if you do a perineal massage several times a week from about 34 weeks of pregnancy, that it can significantly reduce the risk of you having any significant tears and even reduce the risk of you needing an episiotomy, which is where they give you a little cut to the perineal area when you are giving birth to your baby. So it's well worth giving it a go. So perhaps you might have done a perineal massage, and if you hadn't done one, you might end up with a second or third degree tear. But if you do a perineal massage, you may end up with no tears at all, or maybe just an insignificant slight tear. So the first thing you need to do when you do a perineal massage is to make sure your hands are clean, because you are going to be putting your thumbs into your vagina. Secondly, you need to get yourself into a comfortable spot. Now, if you're in your last trimester, which is when it's recommended from 34 weeks, as I said, it's quite difficult to get your hands down there because the bump is in the way. So one of the things you could do is to pop one foot up on the bath, or perhaps one foot up on your sofa or on a chair, and that can kind of help you a little bit more to get in the right position. To do the massage, you should use a natural oil such as olive oil or coconut oil to make sure your hands are lubricated as well, just like you would do if you were doing any other kind of massage. So I'm going to demonstrate using this cardboard cutout. Now obviously it's not as elastic as what the real vagina and perineum is, but for the sake of the demonstration, I'm going to give it a go. So you could do it with one thumb if you want to, or you can do it with both thumbs. For the sake of this, I'm going to be doing it with one thumb because it's easier for you to see. So you basically put a thumb into the vagina at the bottom, probably about 1 inch, no more than an inch into the vagina. And what you're aiming to do is you're aiming to push out the bottom. So so this is the perineum here. You can see the anus there. So you're putting your thumb inside, and you're basically pushing out and then stretching all up the side. Now you can do it with one thumb and then go around to the other side and just keep doing that action up and down the other side for a few minutes. Or if you want to, you can use two thumbs and do exactly the same thing. So you're basically pulling out the skin and stretching it up and down like this. You might find that your fingers get tired after a little while, so just do it for as long as you possibly can. So I usually suggest to do the perineal massage about 3 times a week. You can do it more if you want to. Do it for as long as you feel comfortable, and do it for as often as you feel comfortable as well, from about 34 weeks of pregnancy, and that should really help to reduce your risk of suffering from a perineal tear, perineal trauma in childbirth. So I hope you found that demonstration helpful. Please do subscribe to my channel and look out for further videos on pregnancy, birth and beyond. And you can also follow me on Instagram at midwifemarley.